Good morning and welcome to your Financial Empower Hour. This is Jason Cryderman with Great Lakes Investment Advisors. Tony, as you can see, and all my viewers can see on YouTube and listeners, you're going to hear very shortly, we have an awesome special guest in our show today, in our studio on the show today, Tony. Been very fortunate to have the relationship with a lot of different professionals over the years. And when I do this, I really want to make connections that I can bring added value and services to my clients and the families I serve in the areas that I don't specialize in. Like, for example, estate planning. And in this example today, I have Cora with me. Cora is in the field of health insurance, all realms of health insurances and Medicare and Medicaid plan, all that awesome good stuff, things that a lot of people need to be aware of and need help with. But I don't do those things. So rather than try to be, the jack of all trades, master of none, what we really set out to do years ago is to build partnerships and build relationships with other professionals in the area that are absolutely hands down top notch at their game, Tony. And so it's been probably, 5 years, maybe 6 years. I originally met Cora, and then we started really engaging and started realizing we complement each other very well for the clients she serves and the clients I serve. So it's been a wonderful relationship. So that's what our show is going to revolve around today, Tony, really is Cora, and she's going to talk to us a lot about health insurance. And I'm not really sure of the agenda. I never really like to get one ahead of time. I kind of say, hey, let's kind of just like fly by the seat of our pants, but it's going to be maybe the ins and outs, the goods and bads, the do's and don'ts, all kinds of things that revolve around health insurance. So Cora, thanks for joining me. Thanks for having such an awesome relationship with myself and my team, and welcome to the show today.
Oh, thanks. Thanks for introducing me, Jason.
Yeah, you're very welcome. Tony, anything that you want to start off with by setting the stage or maybe asking Cora? Remember, this is being recorded. We are going to be on radio and on YouTube, so be careful.
Well, sure. I think it's great. It's a huge get. It's always great to have a specialist in the healthcare field who knows a lot about Medicare, how that works. And I know that Cora helps you and a lot of your clients with their Medicare and healthcare planning needs.
Yes.
You have to plan for these things in retirement. Hopefully, you're planning these ahead of time before you retire. But once you get in retirement, there's always a lot of changes happening. The rules seem to change on a yearly basis, the amounts, everything like that. So we're going to get into some of that. And I'm really curious about that. First, I'm excited. Cora, always great to see you again. And Jason, fun every week. I learn something new from you every week on the show. You love to educate our listeners out there on various financial topics to help them with their retirement planning. And once in retirement, their retirement planning as well as they go on. So I've had a great week. I can't believe I watched some NFL football games. It must be close to fall already. I was just getting into the summer. I was just starting to enjoy summer. That's my problem.
Well, as we talked on, I think last week and the week before show, like just the way summer came upon us in May and June, and then the heat through June, July. It was unseasonably hot over there. I know you were mentioning that as well. And here we are. Believe it or not, Tony, as we record this show on Monday, again, it airs on Sunday. This is a very emotional week for myself and my family as tomorrow Carson and Josie start school up at Meridian. Josie's in 10th grade, Carson's in 7th grade, so we'll be taking them to school by about 7:30, 7:45, and then Amy and I turn right back around and we go home, and then we pick up Lexi. And it is very emotional because our oldest is going off to Michigan State. So tomorrow we jump in the truck, we grab Lexi with all her stuff that she could possibly pack into a very small, like 12 by 16 is the size of the room. And she has 2 roommates. So she has a triple. And so we're loading up the truck tonight, and tomorrow we pack it up and head down and drop Lexi off at Michigan State. So it's crazy how fast we've talked about, like your kids already going through college and now they're off on their own. It's like, life just goes way too fast, and Cora has kids of her own, and so she understands and knows when they go from one grade to the next grade, and then you start thinking about graduating from high school and going off to college, and it's crazy. It is exciting, but I try to tell everybody, try to slow down your life, right? We can't slow the hands
Right.
of time. We can't slow the clock, but we can slow down the things we do and allow them to consume our lives, right? And I've been guilty of it. Our family, we get very busy and we get involved in everything, right? Everything and then more some. And it's just slow it down because you need to take in that precious time with family. And Amy and I are realizing that now as Lexi's getting ready to go off to college, like, whoa, this is a big, huge step for us.
Yeah. Well, that's huge. Now, it is a big step. How far away from home will she be?
Well, we got the lucky of the two choices, I guess. So Michigan State is only about an hour and a half, hour and
There
maybe
you
40
go.
minutes from our
There
house.
you
So
go. That's
it's
not so bad.
wonderful. It's
Yeah.
actually where Amy and I went to school. We met at Michigan
Wow.
State, so it's
Wow.
our alma
That's
mater. So
right.
we have some heart involved there.
Oh,
And
yeah.
Lexi wants to go into like forensics and physiology and to do like crime stuff, like CSI
Wow.
on TV, right? So I keep
Wow.
telling her,
Sure.
remember
Yeah.
that's TV. Like TV is totally different than real life, but
Right.
for her two choices last year when she narrowed down where she wanted to go was Michigan State or Northern Michigan. Now, Tony,
Oh,
Northern Michigan is
yeah.
at the top of the upper
Yep.
peninsula, and we're in the middle half of the lower
The
peninsula.
UP. The
The UP,
Upers.
yes,
The
sir. So
Upers. Yep.
from Minneapolis, Minnesota, you're probably closer to
Yeah.
Northern than you are us.
Oh, very, very much so. Yeah.
So that's what Amy and I were kind of like, well, if she decides to go to Northern, that's a 5-hour drive one way in
Yikes.
sunshine in June, right? Because basically
Yeah.
in the UP you have June and winter. So
Yeah.
during the winter, we kept telling her, Lexi, we may not come up to see you for a month or two, and you may not be able to get home. So hopefully that weighed in her decision a little bit. We got lucky. We got lucky. She chose Michigan State,
Sure.
which is awesome for Amy and
Yeah.
I and our family. And it's an hour and a half from home. We ended up buying season tickets to all the home football games, so we'll be heading down there on the weekends.
Oh,
that
of course.
Michigan State plays at home, and so
Sure.
it'll be awesome. We're excited about it as a family.
Yeah, that's great. So now, Cora, welcome back to the show. And for our listeners and viewers who maybe don't know you, why don't you let us know a little bit about your background,
Oh,
what
sure.
you've done? Let us know about yourself. Take a drink of water there and then launch in to your wonderful and illustrious career. Tell us all about that.
Definitely. Yeah. So I have been doing this for over 20 years, and straight out of high school is where I started with insurance and health insurance and things. So it's really been my focus, all the numbers behind it. Even where I went to college for was create the policies. So definitely the analyst behind that has been my focus. Right now, I do focus between M&M, the Medicare and the Marketplace
Oh,
here in
okay.
Midland.
Excellent. Excellent. And you work for Hub International. Tell us about that.
Yeah. So our office here in Midland, we joined with Hub a couple of years ago. They are located, their headquarters in Chicago, and they have over 50,000 employees. So it's a very top
Wow.
tier agency
Wow.
and group of
Yeah.
agencies.
Yeah, that sounds great. So it's an honor to have you on the show today. And I know that you've been a consultant for Jason and his team there when it comes to Medicare planning, because I'm always shocked when you talk about Medicare, the ins and outs. I don't know how the average retiree is supposed to keep track or know about all of the rules and ways to maximize their Medicare benefits, or how to get better Medicare benefits. We've talked about some people might end up paying more for their Medicare premiums based on certain things. Some people might want supplemental. They might want an advantage plan. What are the differences? It can get confusing, can it?
It definitely can. And it isn't just someone who is over 65. It also can be someone who enters Medicare disability. So all
Sure.
ages, I do focus on in really every scenario, because you may be healthy now, but tomorrow can change.
Mhm.
And then reverse of where if we're planning for today, next year might be different. So
Mhm.
I definitely like looking at all the options and the variables based on that. And income definitely does make a difference, along with just your budget, your price.
Yeah, well, yeah, that's true. I mean, to make healthcare and retirement affordable
Oh,
is a key here, and I know Jason works hard to make that happen for his clients. It is going to be probably taxes and healthcare are the two biggest
yeah.
expenses, right,
Mhm.
Jason, that people are going to have in
Yeah, they
retirement.
really are. And Cora and I have that discussion all the time. And you got to be really careful, especially from the aspect of, how I help families try to transition into a happy and successful retirement. And maybe we want to reduce your risk exposure. Maybe we want to reduce your fee exposure. Maybe we want to reduce your tax exposure. Well, depending on certain things you do from a financial standpoint, there's causes and effects on other side of the table. And what I mean by that is, and Cora will get into this today because her and I talk weekly about clients where we start doing things like maybe taking income from our retirement accounts or doing things like an IRA to a Roth conversion. And there's tax brackets we need to be aware of and familiar with. But when it comes to Medicare, there's also this IRMAA thing we got to be aware of and focus on. And so we got to know about it ahead of time. Like this could negatively impact your Medicare premiums if you go over this IRMAA threshold. But you
Sure.
have to understand what are the thresholds, how long might it negatively impact those, what happens after that. And a lot of times long term, it's like a short term pain for long term gain. Like it still might make sense to do that, but I've met too many people over the years that their advisors didn't tell them, hey, by the way, when you do this, you're not only going to go over into higher tax bracket, you're also going to have to pay higher Medicare premiums in 2 years. And so I talk to Cora all the time, and we help our families say, look, on our watch, when we're working with you, you will not get blindsided. We will tell you ahead of time. We'll show you all the tax brackets, the IRMAA brackets, the income levels. We're going to show you everything. So if we choose to do this, you are very, very well educated of what's going to happen and when, and that it is still a positive thing and in your best interest. And again, I couldn't do it without Cora and the help of her and her team. So it's been an awesome relationship for all of the families we serve.
Yeah,
Yeah.
I would say with that, it's not just the 65 because people are retiring earlier and
Yeah,
earlier.
absolutely.
We deal with people, I meet with people that are in their 50s thinking about maybe I'll get to 55. And then that's a whole different
Whole
process
different
of
ball game.
income.
Yep. Mm-hmm.
Yep. Well, hey, we're gonna jump into this and have Cora talk more about this, but we do need to take a quick break and let our listeners know how they can get a hold of you to set up a no charge, no obligation consultation. Why don't you, can you, Jason, let our listeners know how they can get a hold of you, especially if they have questions for you or Cora?
Yeah, not a problem. So obviously at any time as our viewers are looking at the bottom of the YouTube screen, our phone number's there, our Facebook, I'm sorry, our website page is there. Feel free to give our office a call at any time at 989-835-7203. Again, that number here in Midland is 989-835-7203. Or you can always look us up on the web at greatlakes.investmentadvisors.com.
All right, sounds good. And you are listening to your Financial Empower Hour with our host, Jason Cryderman, and our special guest today, Cora Provost. Well, Cora, we're just getting into this discussion, and Jason. So let's talk some more about what people need to know about Medicare. I mean, there's a number of things that we can talk about today. Medicare doesn't cover all things, so they're going to need uh, a plan, a strategy to deal with that, aren't they?
Yep, that's exactly it. That almost no one does just the government version because there's so many other of the alphabet that we need to add on and change. And there's penalties if you only have the government program of original Medicare. You have to add other layers of things.
Mhm.
It's just like the government. You have to add more
That's right.
more things.
Mm-hmm.
Well, that's true. That is true. I mean, I always find it fascinating. My mother is in long-term care. My dad's in assisted living, and fortunately, they can be just a couple hallways apart in the same building, but different parts of the building. But um, it's so costly, and you need to have a plan for it. That's for sure. And I know that without their advantage plans, they wouldn't get coverage. Medicare doesn't cover hearing, vision, or dental, which are the three biggest things seniors need, right?
Yep. And that's where we meet and review things. I specialize in Michigan as far as the networks and things and the doctors and the plans. So whether someone's up in the UP all the way down to Detroit and South, I do focus on Michigan and all the doctors and networks there. And that's exactly it. You have to look at all the options for what you need. And what is wonderful as a Medicare insurance agent is it's the same cost whether they use someone or not. And that is what's nice is there's no extra fees involved with our advanced knowledge.
Yeah, see, that's great. And that's a big concern are the fees and the cost of it all, because a lot of people assume, well, when I turn 65, I'll have Medicare, so I won't need to worry about healthcare expenses. But
Mhm.
there's still the Part B premium, there's still premiums, there's still copays, deductibles, there's still drug costs, all of that, right?
Yep, that's exactly it. And I do like going over mid-year where maybe they're missing some things. Maybe they have an over-the-counter card that they aren't using. Maybe they should be going to the gym for the pool when the physical therapist says maybe you should go in the pool. So we look at all the extras that are already in the plan, built in, to make sure they're using every bit of it.
Yeah, one really interesting thing, a neat thing that happened for my mom lately through her Advantage plan is she has Parkinson's really bad. So it's hard for her to sit down and use a normal computer, and she can't really operate a smartphone. And she had a more complicated tablet, and that got to be too much for her. But through her plan, she got at no charge to her a grand pad. It's called a grand pad, and it's set up and it has a service, and she can call and email. It's just big buttons, and she can do video calls. And they set it all up for her. And I think, it's like $400 to get it and $30 a month, but her Advantage plan covered all of it for her. Which I thought was fantastic. It's been a game changer for her. So it really is neat. And she has no additional premiums for that Advantage plan.
Yep. My mother-in-law is into her second year of nursing home, and that's it. Her plan includes a Samantha. She calls Samantha anytime she wants to talk to someone
Sure.
other than us and her grandkids,
Sure.
and she can just talk to that person when they need to, and that's
Yeah.
just having an extra little bit of help.
Yeah, and that's a lot how this grandpad works too. There's always a live person that she can get if she just touches a button. It's amazing. Things like that are great, and that's what's needed. So, Jason, what do you think? What are some other areas we need to discuss when it comes to healthcare and Medicare?
Well, I got to be honest with you, Tony. We just don't have enough time on this show today, but we'll try to get as
Right.
much in as we can. For all my viewers and listeners out there, if you have any questions or concerns about Medicare that we've talked about so far, or maybe Marketplace, I'm sure we're going to jump into either in this segment or next segment. I really want Cora to spend some time as well on Marketplace, because there's Medicare once you're 65, but what about, as Cora mentioned before, what about if you want to retire in your 50s or in your early 60s, and you got to do what we call bridge the gap maybe until we get to 65. And so you may have to look at Marketplace options. And so that's a big one. Medicare is a huge opportunity. It's also a big deal if you mess up, right? And so that's why you need to work with somebody like Cora and her team. So if you have any questions at all about Marketplace, about personal health insurance, about employer-sponsored health insurance, and gee, my employer's changing a plan, is this good? Or I have an option to continue a plan, what should I do? Please give my office a call. I can get you directly connected with Cora. If there's any questions you have we don't talk about or answer on the show today, let us know. We'd be happy to get the questions off to Cora and have her help you directly as well. But I think that's a big deal, Cora, that we touch on Marketplace, because it's not just 65 and older. Cora works with a lot of people in their 20s, 30s, 40s, as well as I do, and in their 70s, 80s, and 90s as well. So the whole spectrum of all different ages. And we are seeing more and more often, I think, in the last maybe 5 to 10 years, is younger people in their 40s, 50s having to go get their own insurance, whether it be short-term or long-term, because of different employment status changes. And so this is a big deal, especially for people that say, I'm 50 or 55 or 58 and I'm done. I'm shutting it down.
Right.
But I don't think I'm not going to have health insurance. Or gosh, I'm ready to retire, but but I can't afford health insurance until I'm 65. So there's huge options there. There's so much unknown.
Yeah.
Cora, let's talk a little bit about what is Marketplace?
Uh,
What are some of the ins and outs, goods and bads? We'll probably have to do it right after this break.
Yes, I'm sorry to cut you off there. We do need to take a quick break, and we want to give away some copies of Jason's book, Empower Your Retirement. So the next 10 people to contact Great Lakes Investments and mention the show will get a copy of his book, Empower Your Retirement, which is a great book. Covers a lot in there, including some on healthcare, long-term care, Medicare. So just give us a call. And if you just want to schedule a time to talk about Medicare options or the Marketplace or healthcare options, call in as well. That number is 989-835-7203. That's 989-835-7203, or go to GreatLakesInvestmentAdvisors.com. And you're listening to Your Financial Empower Hour with our host, Jason Cryderman, and our very special guest, Cora Provoast. Cora, great to be here. Now, Jason, you had just asked a question. We were wrapping up that segment. We needed to give our information there.
Yeah.
Reiterate that question for Cora. What are we going to talk about here? Marketplace?
Yeah, Marketplace insurances. So we started out the show today talking about age 65 and Medicare and those things. And I think Medicare is very important for those age 65 and older. And as you mentioned, Tony, we always talk about on the show, as well as Cora does, prepare ahead of time, be proactive. Don't wait till the day you turn 65 to start thinking about Medicare. Look into it way ahead of time, get second opinions, have a plan right before you turn 65. You need to know what Medicare covers, what it doesn't cover. You need to know the difference between Medicare and Medicaid and long-term care insurances. That's all very important. But before we even get to age 65, it's really common nowadays that people struggle with health insurance from their employer, whether the employer drops it or they're out of work, they retire early, whatever that might be. So Marketplace insurance, that's really what I want Cora to talk a lot about now is what the heck is Marketplace? What does it mean? How does it help? And how can you help people when they're looking for insurances through something like the Marketplace?
Yep. So with the Marketplace, try not to think that it's going to be too costly. There's almost always financial aid available. You're going to be able to get a discounted rate. There are some that pay more than their mortgage, but most pay less than a gallon of milk because there's just so many options. And I do like reviewing with people before they make the life changes. Let's kind of review the options before you have to hurry up and make a decision.
Mm-hmm.
So as far as timing, we review year round because most of the quick decisions have to be made the last 3 months of the year.
Mm-hmm.
And quick decisions are very hard to make and sometimes not the best way to make a
especially
decision.
at the end of the year, you got the holidays, you got Thanksgiving, and that's when all of a sudden you have this open enrollment or change time.
Yep.
And that's crunch time for a lot of people. And they don't want to think about those decisions at that time of the year. So
Yep.
as Cora mentioned, working with all of our clients throughout the year, being proactive and building a plan, that's awesome.
Yep. And I enjoy talking about, oh, you're going to have a baby. There's also, oh, you're going to have a divorce or, oh, you're getting fired.
Mhm.
But talking about that stuff ahead of time makes it a little less painful, the good and the bad.
Yeah, I mean, you got to be proactive and be prepared, right? For the good and bad. And some things we don't know are coming. But if we do, whether they're positive or negative in your life, it's a life-changing event. As Cora mentioned, you may have an opportunity to take advantage of, or you might have something that's about to blindside you. And if you're not prepared for that, you will be blindsided. And that's very tough and difficult to deal with at those unfortunate times.
And that's why I do love to say that the only cost for me is their time. And a time now is so much better than a hurry up and
Absolutely.
make possibly the wrong decision.
Yeah. Yeah. And that's tough. And a lot of people, my neighbor wanted to retire, but he was much older than his wife. And they had really good health insurance. He worked for the state. So his health insurance was great. But if he retired, he didn't get to keep his health insurance. Mm-hmm. And then his wife, who didn't work at that time, couldn't be on his plan. They would have had to get health insurance, and he looked into it, and it was so costly. And he could have really used help from someone like yourself, Cora, and Jason, because he ended up working longer. A lot of people don't retire when they want to. because they need the health care. I mean, he ended up working until he was 70 because he really needed the health care. And if you retire early, quote unquote early, in other words, anytime before 65, you're going to have to cover your own healthcare costs. And a lot of people don't realize their employer's probably covering half of their insurance costs, right?
Yeah, I think anyone who's seen those Cobra prices are pretty well shocked of the actual cost of the employer coverage.
Yeah.
Easily 1,000 per person in some
Yes.
cases.
Oh yeah, for sure. And even bigger if you're a family, and it's really hard. So there are strategies though that you can use, and there's the marketplace. But then Jason, tax planning and income planning, how much income you have in retirement will affect the price if you're getting buying from the marketplace too, right?
Yeah, absolutely. I mean, we talked about when you're 65 and on, looking for Medicare coverage, you're going to have a Medicare premium if you take subs after that. Well, those premium prices are based on income, previous 2 years previous income.
Mhm.
Well, same thing with marketplace. I think as Cora will probably help us with, because again, I'm not the health insurance, healthcare specialist. That's why I built a relationship with Cora and her team, because income tax, it's all a big kind of puzzle. And
And we're not accountants either.
yeah, and we're not CPAs, we're not accountants either, and we're not attorneys, we're not giving legal advice, but you got to look at all the different pieces of the puzzle. And as long as we understand, and that's really what Cora and I love to do together, is understand all the pieces of these puzzle and how they work together, because everybody's puzzle looks different. Every single puzzle, whether you're married, single, whatever it is, all puzzles are different. So our job is to understand what are the puzzle pieces and how can we help them pull this together. So on that, I mean, yeah, because there are different costs and taxes and income
Definitely.
that have
Yes.
to do with whether it's Medicare or
Yeah,
marketplace,
yeah.
right?
And most of the time after an appointment, they're excited. They're happy. There's good news. Even just having knowledge is the good news.
Right. A lot of people are stressed because they don't know how much is this going to cover? Is this going to cover everything I need? Will I have these really large unexpected medical bills? How will I cover them? And between the two of you, that's a good 1-2 punch to have somebody like Jason who has the overall picture of where, what money you're going to need, where you're going to get it, and having a strategy so you get the most coverage for your money, the most bang for your buck, so to speak. And that's where you come in, right, Cora?
Yeah, yeah. We definitely tailor the choices and the options so that way they know ahead of time. And we
Yeah.
do deal with people that maybe have a job change that's only a few months or a year, or
Mhm,
people that go self employed and just become the entrepreneur that they've always wanted to
mhm.
in their 50s.
Sure.
And Jason is wonderful for giving them that setup to do that. And then I help them along the way as well.
Yeah, that's great. Well, and there are a lot of ins and outs to this. So you help people whether it's the if they retire early, if they're getting health care through the marketplace, or if they once they reach 65, making sure they've got a plan in place to get all the coverage they need, because there are gaps and holes. Maybe you could talk a little bit about the drug coverage. I think that's one of the biggest areas of concern and confusion. A lot of people in retirement need some very expensive medications. And I know it's Medicare Part D, right, that helps with that?
Yep. So that has been one thing that is changing the past year or two, and then is also changing in the future, all their
Mhm.
bills that they are changing. And it so far has been mostly good news where there's going to be brand name price negotiation. There's a limit to the max out of pocket. No one is spending 30,000 a year on their drugs as long as it's covered. The big change is they still are fighting on that weight loss drug coverage,
Mhm,
where I know a lot of people on it, and it almost this point is not a choice. You need to
mhm,
lose the weight for all the other medical conditions that you're working with, and that
Yeah.
is one thing that still hasn't been added to most of the plans is the
mhm.
weight loss drugs. Its majority is only employer coverage, unfortunately.
Yeah. Yeah. So, what about once you hit 65, you have Medicare, you have Part D? Is the drug coverage? Are there other strategies or things that can be done to maybe help with drug costs? Like, do the Advantage plans or supplemental plans help with drug coverage at all?
We have really good Medicare Advantage and prescription drug plans in Michigan. The carriers are very, very nice, where a lot of generic drugs tend to be zero, especially if you're getting
Wow.
like a 90-day supply, or
Mhm.
if you're willing to try the mail order. Uh, a lot of seniors spend less than 100 or two per year on their drugs, so
Wow.
they're excited for that.
Mhm.
Now we do have a new cap. This year is 2,000. Next year is 2,100 for covered Medicare drugs for the year. And 2,000 a year, when you're talking about $1,000 a month drugs,
Mhm.
that is a real lifesaver for them.
Sure. So in other words, the most you can spend out of pocket is $2,000. Is that
Yeah,
right?
that's
Okay.
exactly right this year.
Yeah, yeah, that's good. That's good to know. And you know what? We're going to take another quick break, but then we can come back, talk about some other things. Jason, I know you have some questions, and maybe Cora, there's other changes that are coming down the road or that have happened recently to healthcare or Medicare that our listeners need to know about. You can touch on those, but first, let's talk about how our listeners can set up a consultation with you, Jason, and talk about this, see how it's going to fit in their overall financial and retirement income plan, right?
Yeah, absolutely. Again, if there's any questions for my viewers or listeners today, for myself or for Cora, or gosh, I don't know, you got questions for Tony for some reason. I mean, feel free to.
Hopefully not.
No,
Yeah.
actually, you know that Tony. Every once in a while, listeners, we do get a call and someone says, "Hey, where is Tony in Minnesota? And he needs to take me ice fishing on that city that's out on the ice that he showed us pictures of." And so, if you
Yeah.
have questions for Tony, you're not alone.
Yeah.
But give us a call here at the office in Midland, 989-835-7203. Again, that number here in Midland, 989-835-7203. Or you can always check us out on the web at Great Lakes Investment Advisors. That's advisors with ORS, Great Lakes Investment Advisors.com.
All right. And we'll be right back. And we're here on your Financial Empower Hour with our hosts, Jason Cryderman, and special guest, Cora Provoast. Cora, great to have you here today. A lot of great information so far to help our listeners out to understand what they need to know about Medicare. And what else are we going to discuss today, Jason? What do you think? What do you want to cover?
Well, you made a really good point before the end of the last segment there, Tony, when you said changes. And if there's anything we haven't learned in this world, especially since maybe the COVID era, whether it be taxes, whether it be financial planning, whether it be insurance planning, estate planning, there are so many changes that are happening daily right before our eyes. And that's where I think it's so important. I tell everybody in all my classes, I tell them in my book, I tell them on the radio show every week, get a second opinion. Get a second opinion on your investments, on your financial planning. Get what I call a financial x-ray or financial MRI to learn what the heck's going on within the money. Are you on the right road? Is there anything you could do different or better? I say the same thing when it comes to estate planning and when it comes to insurances. And that's one of the things I love about Cora and her team is she will provide her time and her valuable knowledge to give second opinions on, well, where are you today? What coverage do you have? What are you paying? What alternatives do you have that could be as good or better coverage? And one of the things that she mentioned that opened up my eyes many a times, we just had a visit with a client last week about it, was, are you taking advantage of all the, I'm going to call them extras? And you mentioned it for your mom, but it's one of the big things is over the counter stuff. How many times you go to Myers and Kroger's and you buy stuff over the counter that we pay money for every day, and it's expensive. This stuff is not cheap, and it adds up. And people don't realize that there's a lot of these freebies or extras that you have. You need to take advantage of those. You mentioned the pool time. If we don't know there's stuff available to us, how can we take advantage of it? So being able to meet with Cora to go over, here's what you have, here's what your coverage is. Not only that, here's what the added benefits, perks are. And if you don't have some added benefits and perks, well, maybe you want some, you should maybe look at a different plan. But if you have them, by all means, take advantage of them.
Yep, and that's exactly it. For my current clients on Medicare, this is a pretty much keep it if you want it year, where at least once I've set them up, I'm not really suggesting very much changes. And those Medicare plans keep on rolling, so they don't have to do anything. They can just look at their flyers. Now, on the marketplace side this year, there are some huge pricing changes.
Yeah.
So I'm actually recommending about half of my clients. I'm sending out messages now. Half my clients review and meet with me because the changes of pricing with the income based has huge swing this year. So if someone is on the marketplace, I strongly recommend they find an agent or me and review their options.
Yeah, that's a big idea. I mean, so there's one of those changes that if you're not aware of it and you don't seek out advice, and sometimes again, a second opinion, let's say you already have someone you're working with. Oh yeah, we already talked. Does it hurt to get a second opinion? If it doesn't cost you anything, spend 5 or 10 minutes with Cora or another advisor out there and say, look, I have this, I heard this, but can you give me a second opinion? Let me know, am I on the right track? And as long as you're on the right track, that's awesome. You hope you hear the exact same news in the second opinion. But just like your health, if you get a second opinion, honestly, you're like, oh, wait a minute, that's different than the first information I heard. You rather find that out ahead of time so you can figure out the plan proactively versus just say, oh, I already talked to one person, I know what's going on. And then after the fact, you get blindsided and it's too late.
Right. And, healthcare blindsiding seems to be a common theme amongst retirees. And that's because they don't have a team like yourselves that can help them prepare for what's going to be needed in retirement regarding healthcare, or even, like you say, before retirement, or even younger than 65. So we've covered a lot here. I know that there are some changes that might help. That in the big beautiful bill, there's that $6,000 additional standard deduction for seniors 65 and older. That's a tax deduction on top of the regular standard deduction, and on top of the senior deduction of $1,600 per person. So if you add that all up, if you're a couple and you're both over 65, you could get a $45,500 standard deduction. And that will really help with Medicare costs as far as making you those who might have qualified for higher Medicare premiums. That'll put them out of range because they won't have to pay higher premiums because it'll put them in a lower tax bracket, right?
Yeah, we definitely should spend, or with any agent or Jason, spend time to review where we're adding the numbers and where we're not. The government likes to add every penny they can. So like on the marketplace side, we have to add taxable and non-taxable. We have to just add every penny because they like to double count things.
Yikes.
Yeah, that's a big deal. It is. And we find that a lot through, for example, how much of my Social Security is taxable. We've talked on the show, Tony, when we've done Social Security shows.
Yep.
And one of the variables, and again, so taxes is an equation that the IRS, the government, has created, and they get to build the variables in the equation and the pluses and the minuses and the multiplication factors. They design these. And so to determine how much your Social Security is taxable, one of the variables they use is 50% of your Social Security is thrown into the equation. It doesn't mean it's taxed yet. Doesn't mean it's taxable at all. It just means we're going to throw 50% income in the equation just to determine if or how much any of your Social Security is taxed. So as Cora mentioned, the government likes to build these equations, these variables. Most times they're confusing. Most times they are I would say almost all the time stacked in their favor if you don't understand the variables, right? If you don't understand the variables and work with a team that understands it to help tilt the odds in your favor a little bit, a lot of people end up paying too much in taxes, too much insurances, too much. They just end up paying too much of what they just don't know. They didn't know, or the current people they're working with, I don't know, just weren't aware it didn't help them like that. So again, get a second opinion. Call myself. We can get you connected with Cora directly for any of these health insurance questions, whether it be marketplace or Medicare or supplements or that IRMAA. As you mentioned, Tony, now there's this $6,000 additional deduction in this big, beautiful bill. There's a potential opportunity to go ahead and go above the IRMAA threshold. You're going to get some of that. So there's ways to offset different income depending on what your situation is. And I learned a really cool, interesting feature last week from Cora. Is there's also and I don't even know if I'm allowed to say, there's also a way if you have a higher income for 1 year, and so you're above the
Yes.
IRMAA threshold, there's an option that you can request after the fact, the following year, you can request to have your premiums reduced if there's been a major life-changing event. Well, again, that's why Cora says if there's a life-changing event coming up in the future or just happened, you have to talk to us, talk to myself, talk to Cora, talk to another professional. If you know this life-changing event is coming, you can prepare for that and maybe reduce your expenses phenomenally. Or
That's huge.
just after it happens. Nobody wants to talk about it after a death, but after a death happens, sit down with your advisors, get a second opinion again, because you might have benefits or things coming to you that could become a benefit. But if you don't know about it again, it's pretty hard to take advantage of it.
It is. Well, I'll tell you what, we're almost out of time, but I know a lot of listeners and viewers are probably like, I don't understand Medicare and what I need to do to get, do I need Part B? Do I need a supplemental? Do I need an advantage? What are the different parts of Medicare? How do they apply to me? I have these medications. I want this doctor or this clinic to be qualified. How can you help me? Those are the kind of questions, Cora, that I know you answer for people each and every day. And that's why you're a specialist in this field. So before we go, I want to make sure our listeners pick up the phone, give you a call, or schedule that appointment through the website, Jason, and you can direct them to Cora and bring her in if they need Cora's expertise. So before we go, first of all, thank you, Cora, for joining us. Our
Thank you very
guest,
much.
Cora Provoast with Hub International. Thank you for being here. And Jason, another great show. Listeners, pick up the phone, set up that consultation, 989-835-7203. That's 989-835-7203, or go to GreatLakesInvestmentAdvisors.com. And that does it for today's episode of your Financial Empower Hour with our host, Jason Cryderman, and our special guest, Cora Provoast with Hub International.